Good evening. Hello, friends. Thank you so much for joining me. If you don't know me, I am Tia Ramey, and I love giving communication tips and strategies to leaders to help them both personally and professionally. Tonight, what I did is I thought I would invite my sister. This is Elisa. Say hi, Elisa.
Hello.
I'm inviting my sister to have a dialogue with me. She and I have had this interesting journey where we talk about really difficult, hard topics. And what's interesting about our dynamic is my sister and I come from two very different perspectives. I'm a millennial, more like an ex-millennial, and she is very Gen Z. I'm in my mid 30s. She is in her late teens. And so, of course, we view the world differently. We have different relationships with technology. We have different relationships with a lot of social justice and what does these things mean to us, like diversity topics, all the sorts of things. And we talk it through. You know, I learned from her, she learns from me. And one of the agreements that we made is to try our best to one understand where each other's coming from.
Right.
Right.
Very much so. We're good at that, though.
I mean, we've had our journey, you know, and then to also, when we have a criticism, we try to come from a communication perspective only. And so I want to demonstrate tonight what does that look like to have this sort of difficult dialogue with someone of a different generation, and to give those communication tips and strategies. But there is a topic that we're going to talk about, and that is, why is therapy important?
Yes, we are.
So why don't you tell me just a little bit about this video that you selected? We're going to do a reaction video, and I'm going to watch this for the first time.
Right.
She's giving me like a brief little snapshot, and I'm hearing, you know, I'm not as well versed on trending topics as she is, so she's bringing it to the forefront, and we're going to talk it through. So tell us a little bit about the video that you saw.
All right. So there's this video going around talking about, I would say the whole video is kind of like the cons of therapy, how it's unimportant or unnecessary to a lot of people. And I thought it was interesting because the majority of our generation, Gen Z, is all about helping yourself, therapy, mental health, that sort of thing. So it's kind of the opposite. Mm-hmm. And a lot of people have been talking about it, and I think that we would have an interesting take on it at a different aspect of like tackling it in a different way.
Okay. And who's this person, this human
yes.
that you said is speaking against therapy?
Yes. Andrew Tate.
Okay.
Is part of the red pill manosphere, alpha male sort of scene.
Okay.
Kind of a meme, but not really. No one knows if he's serious or not, which is the very confusing part now I think about it. But yeah.
All right, well, let's just dive in. We're going to watch it, and then we will react, and I will come back and give some of my thoughts on how to communicate on this topic if you run into someone who thinks like Tate.
Yes.
Something like that. Okay, here we go. Hit and play.
Tate speech. I'm here with my coffee, chilling. And today we're going to talk about therapy. Because I have a gripe with therapy. And if you've been watching my channel for long enough, you know that I have a gripe with many things. And I'm always right. I'm eternally correct.
Always right.
If I have a gripe with something, then that something is in trouble. Because my logic is infallible.
All right.
I have a genuine problem with therapy as a whole. So let's start from the beginning. What is therapy? Well, therapy is the idea that you need to go through life crying about the bad things that happen to you, mortal beings as if they are God, and that somehow that makes things better. You need to go to some other normal human with their own problems, who's no better than you, and sit there and go, oh, this happened, that happened, and sit there and bitch about it, and that somehow this inaction is going to improve your life. This Tate speech is going to have a lot of different elements to it, because my problems with therapy are varied. But one of my largest problems with therapy is that it's an antithesis to my worldview. My worldview is that action always wins. Momentum, speed, power, forward, forward, forward. Anyone who's done business with me knows the first thing I say is, okay, good idea. How quickly is it done? The sooner it's done, the sooner it makes money. If it takes 2 days instead of 1 day, that's one extra day we've lost we can never make money during. You want to be a millionaire, do things quickly. Action wins. Therapy is not action. Therapy is sitting and crying and complaining. Talk is not action. Fucking chit chat isn't action.
Oh, wow.
Is it
Wow. All right.
No. G knows. Action is doing something. If you feel depressed, G, you're going to spill my fucking coffee. You're really That's all. If you feel depressed, you go to the gym. You do something. You don't sit and cry about it. Well, I feel depressed. Let's go sit and have a talk. Words don't count as action, not in the harsh realm of reality. So that's one of the first problems I have with that.
Yes.
The second problem I have with therapy is
Probably make money.
I'm not going to stop here for a second.
All right.
All right. Okay.
All right, give it to me. Thoughts?
I'm still trying to decide if he's serious or not, but either way, serious or not, I think there is, for lack of better words, a high amount of lazy thinking here, because he just defined therapy, but there's not only one type of therapy. There's talk therapy, exposure therapy, other thing, and he's mentioned the gym. For a lot of people, the gym is their therapy, whether they're getting it out in like sweat or whatever. So in a way, that's still contradicting the prior statements.
It's interesting, and whenever I approach discussions where someone may say something I think is completely bizarre, I try my best to hear the intent in the message first. And I think that, what he's trying to say is if you're sitting around talking about your problem, you're not actually doing anything about it.
Yeah.
I think that's what he's trying to say. At least that's what I heard.
But like you said, he's talking about a problem, about society. So then you have to talk about the problem to address it, to fix it.
Yeah, that's the part where I think that, in a traditional sense, you would say, if you're talking, you're not doing anything. And sometimes talking is the first step.
Correct.
Right?
Right.
And the thing about therapy is I think that everyone has different reasons why they go. Not everyone is actually, I think that sometimes the reason why it's hard for people to go to therapy is because they actually don't want to talk about their problems.
Yeah.
So that's a big step for them.
Right. I don't know. It kind of also takes away the courage of saying you have a problem and doing something about it. I think that's something very courageous that a lot of people can't do. So I commend anybody that can. It's kind of
you might have to speak up.
But yeah, it's kind of like denying the experience of I have a problem, I'm going to address it, and I want to fix it. I don't think there's anything wrong with doing that. But I mean, all right.
Well, I think that part of it is sometimes people don't even know they have a problem.
Sure.
And that's what happens a lot of times in therapy is that what you see is that you're not getting the results that you want for your life. And you don't know why you're not getting the results you want. And so you're looking for someone that's unbiased on the outside to maybe help you walk through some things in your life so that you can identify and figure out what the problem may be.
Right.
So his opinion kind of assumes that people know what the problem is before they go in. So like, for example, they might know that they're struggling with their marriage.
Right.
They know that they have trust issues. So with his logic, he's saying, well, you're not doing anything about your trust issues by going around talking about, I don't have trust issues. What you are doing is you go to therapy to identify, well, why do you have these trust issues? And having someone to talk to about those sorts of things to help you walk it back, process those feelings, and then moving forward so that way you can close the gaps and find out which of your trust issues may be illogical, which ones can be validated, which ones aren't, and then what to do with that. I think that that's kind of the point of therapy. But most people don't exactly know how deep something is that's causing the problem.
Right.
So I think if most people could just solve their problem and just do something about it, they wouldn't even bother to go to therapy. I don't know anyone that's like, oh my gosh, I really want to go to therapy. It's been so stigmatized for so long.
I think that's interesting. The other part I noticed was usually in these conversations they talk about money in some way. Talked about like, what was it? It was fast action, making money, that sort of thing. If it's not fast, you're not making the money. And it's weird how money is brought into conversation about health and your mental success in a way, because some people do equate success to money, but at the same time, that's not everyone's definition of it. So it is very biased. I don't think it's a bad thing that's biased, but it's a weird point to come from that it had to do with money.
So tell me what you heard. When he made the comparison about money, what did that comparison mean to you? It sounds like that's where his communication really broke down for you.
Yeah.
So what was that comparison like? What did you hear when he said that?
If you're too busy crying and talking, then you can't make money, because then it's not an action, because the action is what makes the money. You have to get it out fast. Talk therapy would be considered slow because it is a process, but you equate the fastness to efficiency, and efficiency meaning money, which is where it's kind of breaking down a bit for me.
I think that that's kind of the problem with this dialogue. And like I said, this channel is about communication tips and strategies. And I love figuring out where communication breaks down, because sometimes when you're talking, what one person hears is not exactly what you said. vice versa. But in these sorts of videos, it's good to even hear like, this is what I heard. And I think for his example on money, just period, he makes a lot of assumptions. One, like I said, he assumes that people want to go to therapy to complain. That's not always true.
Fair.
Two, he's assuming that someone's goal is to make a lot of money.
Right.
And that's not, and I don't know his audience. I don't know who watches his videos, and I don't know who values what he has to say. Yeah. Maybe everyone who watches his videos are people who are looking to be a millionaire or a billionaire, and that's why he's giving that kind of tip. It's relevant to the audience. So I don't want to make an assumption either, and that's a communication tip, is try not to assume. But I can see why that would lose someone, because sometimes I think in our society, in our culture, we do assume that people who make a lot of money or people who are financially well off must not be dealing with any issues.
Right. And usually for like y'all's generation, millennials and up, it was about survival. But for Gen Z, we care about your happiness and like your mental health while you are successful. Because if you're not happy to us, then it is not worth any sort of survival.
That is that word is like so triggering for me, that happy word. Mm-hmm. So talk to me about your generation, Gen Z.
Right.
What do you all, when you go to therapy, what do you all see it to be, and what exactly are your goals?
Ooh, never been asked that before. I'd see it as a way to deal with triggers, identify what they are, have just someone to talk to. A lot of us don't have that anymore, just somebody to talk to properly, usually like over the internet or something, looking for a human connection, or we want some sort of label majority of the time.
You say you want a label?
You have to define something. It is a common thing to, like, for example, have anxiety or depression, any sort of disorder. So it makes sense to why you act the way you do, so you have an excuse. Sometimes, not all, but it is a common theme that I see.
So, like, you're looking for, like, a cause, a reason.
Yes.
You want a diagnosis.
Yes, I act this way because I have this, or whatever. They want something like that.
So, in once you identify what this label may be, what's next? Because that's, to his point, is like, okay, now what's the action? Like, what is the next step after that?
Then you have to accommodate my needs because I have this problem.
Oh my gosh.
Yes. Do you see the problem here?
Okay.
Yes.
Okay, let's back up.
Yes.
Okay, let me understand. So in your perspective of how you and your friends and your peers, and again, Elisa is 19?
Yes, 19.
She's 19. I'm in my mid-30s. So in this video, if you're just now tuning in, thank you for those of us who are joining, is why is therapy important? And we're talking about this from the perspective of two different generations, trying to figure out how to bridge the gap and come to some level of understanding.
Yes.
So you were saying that for you all, therapy helps you to identify a problem for which you would like a diagnosis. Sometimes, and it sounds like the next step is to have some level of accommodation. So you want to take this diagnosis to a close loved one for an explanation, so that they can now accommodate you on that journey of healing, or just to be accommodating.
Now, do you think it would be family, but it's actually the whole entire world, which is why our language has changed as a society. It's all have to be like, well, what about these people? What about these? So we have to have a language that accommodates everyone. So now that you have this disorder or whatever it is, now we have to change all of our language to be like, well, that doesn't include me, or I have this past. That means you should change your speech about this, have more things about this problem, whatever it is. So sometimes it's from family, the majority of the time it's from the rest of the world. That's why we're changing our language so much.
That's loaded. Okay.
Yes.
So I think what's interesting about that is, and you're right, I think that all of these diversity initiatives have adjusted our language. Now, I say that our language has changed based on what we perceive diversity to be, but you're bringing in a mental health piece.
Yes.
And you're saying that we're not just accommodating people on the side of their culture or race or religion or whatever the case may be. We're accommodating their mental illness.
And that's why we use trigger words that would get the attention of the prior groups. Like, let's say it's feminism, racist stuff, all that sort of thing. So they use words like, this is violence, because that would catch the older generation, because they were like, well, we've experienced real violence, so no one's going to listen to us because they don't want their kids going through violence. So then it creates this buzzword of, now this is violence, this is bad, this is something phobic, this is whatever sort of thing.
No, so are you saying this as a cynic, or are you saying this is like an educator?
See, I don't even know what it is anymore. it's very blurred because the Gen Z is very segmented into the rational and irrational. Not even saying that in terms of to bash anyone, but that's kind of what we're separating to. Because like to us, someone is always wrong. There's no double truth, and if there is, that usually means the argument is usually faulty according to like our debates of what I've seen and what other people have seen. It's usually like there's either no middle ground or it's too black and white, or like yeah, the thing. I think I said that right, but yes.
Man, I mean, honestly, just based on what you just said, and this is you just cracked open a big door for me.
Yeah.
I hate what I'm about to say.
That's unfortunate.
No, I hate what I'm about to say, but based on what you just said, for me,
Mm-hmm.
And where I come from, I'm trying not to agree with Andrew Tate.
I mean, I don't think that's a bad thing if you do see some of the points though, because I do understand some of the points. I do agree with all of them. No,
Yeah.
but I could understand where it's coming from because I do think it is helpful to someone out there because we do sometimes do a bit too much of coddling, and I think he may be the other extreme that a lot of us may need to be like away with coddling, that sort of thing. So I don't know. I feel like there's some room for it somewhere for someone.
Where do you think the line is?
Ooh, that's hard. Because now I think about it, the whole world is segmented into Democrat, Republican, liberal, conservative. So now I think about it, I don't know because we haven't come to a middle ground in years.
I mean, let's put this
I
in a
don't
real
know.
life situation, right?
Okay.
You go to a therapist,
Right.
and you talk about your issues. Your therapist diagnoses you with an anxiety disorder,
Okay.
let's say, and you go back to your friends or your loved ones or the world, your job, and you say, okay, I have anxiety, right? But the job that you work for and everyone else in your life still has needs, and they have their own issues too, right?
Mm-hmm.
So what is the line between I'm accommodating you or I'm asking you to come up, and also meet other people where they are as well? Like, what does that look like? And in terms of the expectation, because, part of me, I sometimes I feel like the Gen Z is asking a lot of the world, and they're not really telling us what they're willing to give to get there.
Yeah. That's a hard question because we're all defined by fear now. So I don't know if you even can define that without very extraordinary consequences. But I guess I've never thought about that now that you say it.
So, and I'll say, I think that therapy is very important. I wouldn't go to the extreme, and I understand that, this YouTube channel that we're watching here, he's trying to get views and he needs to say crazy things.
Yes.
I think that therapy is very important. And I do think that people need to have very realistic expectations for why they go. And I do think it's great if you can identify your triggers. But I think that therapy is better if you go so you can manage your triggers. And that's where the action step comes in.
Yeah, we have a problem with that too.
I mean, and those would be better words to me. If we're just talking about, like, if you want to communicate why therapy is important, and you're talking to your loved ones, or you're talking to someone that you're asking to be patient with you, and you're asking them to not write you off because you're dealing with some mental health issues, instead of saying, I'm going to identify my problem, and that's where he feels like this is a waste of time because you're just going to go talk about your problems. It's better to say, I'm going so I can learn how to manage my issues. I think that's a better word. It's an action word versus it being just something that's passive.
Yeah, okay. I see what you mean with that. Because since this is the whole red pill thing, and normally the red pill and the blue pill community, they attack each other. So by using words like cry about it, stuff like that, that would be something that no man wants to hear, that he's crying about something. So I do see. Okay.
Yeah, I mean, because then you're saying, we know what our issues are. Oftentimes, I think that we can know to some degree, like, this triggers me. Mm-hmm. And for me personally, I'm an advocate for therapy. I'm not here to speak against therapy at all. I love it. I think that mental health and that journey is very important. And I think that, and I encourage people to go down that journey. But again, I do think it's great to have realistic goals and expectations, and realistic goals and expectations for the people around you. So I personally feel like, okay, now that I have identified this trigger, now my goal should be, how can I not be triggered?
Right.
Because I don't believe that my triggers are someone else's burden.
See, that's where we differ.
Okay,
our generations.
Tell me. No, tell me. Talk to me about that.
No, I do agree with you. I'm saying in terms of our generations, it's everything gets a trigger. There's a trigger warning for like, I don't know, natural hair, eye pulling, all sort of things. It's like weird things I didn't know required a trigger warning, but now we have to use language that won't trigger someone else because then that can trigger their like mental health problems, a panic attack. Then that is violent. It's all spiraling. Now I think about it, every single argument is a spiral of what it could lead to, potential. It just sounds like a lot of fear. But yeah, I do agree with you guys on that sort of thing. I don't believe triggers are everyone else's responsibility, I think. Because anything could be a trigger. So isn't that so broad to where it would be kind of unnecessary to worry about everyone's? Because someone's trigger could be some wallpaper that they saw when they were abused in their home. Anything could be a trigger. So what's the point of worrying about everyone else's?
Yeah, and I think that that's the part. I don't know that there's a long-term strategy here that's wise, because when you try to create this environment where people have to be afraid of offending you, and it's become extreme, the pendulum always swings. Right now it'll swing hard to the left and it'll go really hard to the right? That's what's going to happen. So eventually everyone keeps failing, no matter how polite they try to be, no matter how accommodating they try to be. They can't keep up with all these triggers, and eventually people will stop caring.
Oh yeah,
they'll stop caring altogether, and they're like, forget that. I don't want anything to do with it. That's your problem. Deal with it. And all this compassion stuff comes to an end. And now we see, hence the video we just watched.
right.
It's a total rise in the opposite direction. It's getting a lot of attention. It's getting a lot of traction. And we have big communication errors on both sides because no one wants to be in the middle to try to define what's the line, where's the boundary, who's willing to give, and how do we become more patient with each other on this journey of trying to support one another in mental health. But honestly, Are we even defining what that means?
I don't think so.
Like, when you think of mental health, what does that mean? What does that even mean?
I would argue contentment.
Contentment?
Yes. I don't believe permanent state of happiness, or like, because people do, the idea of chasing happiness is so exhausting when you actually think about it. So if you're just like content to where if anything happens to you, you're not down for too long, sort of thing. I think that would be the idea of mental health.
I think of mental health. I like what you said, and I want to validate that.
Mm-hmm.
I think that it is very important to learn how to live at a level of contentment in your life.
Right.
And I would agree that most people I know that spend their life chasing happiness seem to be really miserable.
Yes.
But I have a different definition for what that means, at least for what I think it means to be mentally healthy. And I think that people who are mentally healthy have a good relationship with time, nature, and math.
Math, do tell. All right.
Those are like the universal languages that you cannot get away from, right? And if you can face those things, if you can make decisions that are healthy for you over time, not just like where you are right now, but across time, you're not focused on instant gratification. You're not focused on the past. You're not focused on the future, but you can be present and you can make healthy decisions in the present. I think that's important. Nature. You cannot get around nature. People try to defy nature and it always has serious consequences, and nature hits back hard.
Indeed. Yes, it does.
Indeed. And if you keep trying to get around it, there are serious consequences for it, for which you will pay. And people who cannot handle or deal with nature usually are very insecure people, and they're afraid of their world shattering, and they have to try to make people bend to their triggers because they don't want you bursting their bubble. But nature will do that. Nature is going to burst your bubble. Nature will tell you what you can or cannot have eventually. And then math. I say math because numbers never lie. And if you cannot face the numbers tell us a journey. The data tells us a journey. The analytics, the statistics, all of these things tell a story, and they don't lie. And if you cannot face the math, numbers, and see where things are not adding up in your life, then I think that you've got some serious mental health issues. If you can do time, nature, and math, and live, and that's what I call reality. And I guess what I'm saying is if you have a healthy relationship with reality, then I would call that being mentally healthy.
I can agree with that. Yeah, I think that works.
There are some things I think we're going to pay for in a major way. I think I just do. I don't think that our Western world has a healthy relationship with reality at all. and we keep trying to push the button, and I think that we're heavily triggered because of it.
Yeah, I see a lot of ungratefulness. It does. If I'm not gonna lie, it's a little triggering to me a lot of time when I see it. It's the whole word that I come across is ungrateful. Is what I'm saying. Like some of the complaints made, I'm like, really? Why? What is the point?
And I mean, it's interesting because people can be very grateful and still go through a lot of mental health issues, right?
Yes.
I mean, trauma that's big.
Oh yes,
that's a big one. And you can try to be as grateful as possible and you still facing trauma, which is why I think therapy is important. Mm-hmm. But here's another thing. And as I said, I think everyone has different goals for why they like to use therapy. Elisa indicated that in her generation, one of their goals is to be able to identify and diagnose their issues so that they can really ask for more compassion and patience, essentially,
yes,
right?
Pretty much.
From their communities to support them on their journey while they're trying to get better. And for me personally, like one thing I love about therapy is I do not believe in where we're so polite and we're nice to people all day long, and then you come home and then you're letting your guard down and you're rude and snappy and mean to people at home because you're dealing with pressures of the day. And though I believe that everyone kind of needs a place where they can be raw and fall apart and not have to worry about people's feelings, I think that's for therapy. I don't think that that's for your spouse or your loved ones or your kids to have to burden your attitude and your pain and your stress. I think it's better to show up for the people who love you even more. I think they deserve more of your love and more of your politeness and more of your gentleness and more of your patience than what we give the average stranger throughout a day. So I think that therapy is a great place to have somewhere where you don't have to worry about someone's feelings and you can let out those frustrations. So when you go home, you can be in a better place to have progressive, productive dialogue, and to his point, take action. I just think that people dump on their families and they dump on their kids and they dump on their spouses all the time and they expect their spouses to burden all their stuff. And I think that's how families traumatize each other.
Oh yeah, that's just like a normal thing that happens. Because now trauma is so like joked about and it's just a regular topic of conversation now. Legit, I could be in a conversation with somebody of my generation and all of a sudden tell me all issues with like their abusive stepdad or whatever. They go down the list. And we make posts about like, well, someone's trauma dumping, that's a sign of a deeper issue, or these are signs of anxiety. They have all these all over Instagram. But I'm like, what if I didn't want to hear the trauma dump? Why do I have to accommodate what they were talking about? I'm like, and I get it, and I hear you, you're hurting, but why do I have to care? I don't understand that.
See, and that's an important point. It's important to realize that people don't have to care. Yeah. And if you're entitled to that, if you're entitled to care, you're going to be disappointed all the time.
Oh, yeah.
I mean, I really do think it's important to talk to people as though it's a privilege to be heard. Mm-hmm. And it's a privilege for someone to even want to dialogue with you. But it is not really a right. And I think we're too focused on our rights.
Oh, yes.
Right now. Mm-hmm. I mean, rights are important, but some things really are just privileges. And I think that maturity identifies rights from privilege.
Oh, yeah.
So let me ask you this, because you mentioned something about abuse. Oh, that's yes. Another word that I think is up for translation, like mental health, where people have their own version of what that word means. And your generation is very different than mine in how we identify what is abuse. Right. So what would you say is abuse?
I guess from what I hear, and to them, they would say their stepdad whooped them a few times. Not to me, and it's because culturally, I don't see that as abuse.
I'm asking you, what do you think is abuse?
Me?
Abuse? Yeah.
Oh, I would say any form of humiliation or gaslighting, denial of experience, or physical abuse.
So you give an example. If you gave it like a definition, what would it be?
Oh, I don't. That's so broad. I don't know. It's hard.
You know, it's so important because this is where it's difficult. You know, and you said humiliation.
Yes.
Right, is abuse. Mm-hmm. Right, and what else did you say? Gaslighting.
Yeah, denial of any experience, that sort of thing.
And how do you identify if someone is denying or if they just have a different perspective?
Well, they can say that they saw something differently than you than saying that never happened to you. I feel like it's still how they put it, probably, is how that usually goes down. Because it's a common thing to where older generations shut us down, where they say, you don't know nothing about this. What you know about this? In those words exactly. So then it leads us to not talk to older generations because we feel like ostracized all the time. I feel like, okay, I guess we don't know anything. So I can't talk to anybody now because apparently I know nothing.
Yeah. That's what's interesting. I think that that happens to a degree where someone is accusing someone of something, right? And then they say that never happened. And usually what they're saying is the way you're saying it, that is not what happened.
Yeah.
So it's very important to use precise words. True. And a lot of times when we first start talking about a situation, like let's say, get a spanking as a kid. And when you're talking about it, you're saying, you practically beat me to death. And your parents going to say, that never happened.
Oh, yes.
And I always say it's important, do not exaggerate. This is a big communication tip. Do not exaggerate. If you don't want someone denying what you have to say, then it's very important to be precise and talk about what happened. Like, you hit me when I was a child. You could say that, but if you're like, you beat me to death, I almost died, you're like, that didn't happen. Because you set yourself up for disappointment. And I think that when you want people to validate your experience, you cannot try to snatch them into your world and what it seems like to you. You have to come on the outside of understanding what that world also looks like to them if you want them to validate what you're saying.
I can agree with that.
I just think most time people exaggerate first, and then if you exaggerate the situation, then
you get the denial.
You get the denial
of experience.
I see that happens. I see, like, for example, maybe a little boyfriend or girlfriend got into it, right? And they had, like, she got all in his face and he pushed her off. And then she'll say, he beat me. And he's like, that didn't happen. And it's like, I just pushed you a little. Like, you shoved me and I fell and broke my... Like, people exaggerate when they're emotional. And that's a big problem. So I think if you really want to talk to someone and tell them what they did wrong and you want to address a behavior, it's so important to speak with as much precision as possible and try not to allow your emotions to get the best of you when you describe that.
That makes sense.
Now, I do say this one thing because I think that, and I write about this in my book, that communication enemies are liars, deniers, and ignorers. Liars are people who they don't tell the truth. Deniers are people who don't really care about the truth, and ignorers are people who, they throw the truth out. Like, they just don't want to address it all together. Some people, you have to identify who are liars, deniers, and ignorers from people who are just, they don't agree with your interpretation of what the facts are. And those are different places. And sometimes we think someone's being abusive because they don't agree and they're not validating what we have to say. And that's not necessarily the case. It means that I want you to state your perspective of what you saw, and then give me a chance to state my perspective from what I saw. And then hopefully we can put these two pieces together, because that's the point of having a conversation.
Right.
And that's the part, like, after you leave therapy, and of course, when you talk to your therapist, you're only giving them one side of the story.
Yeah.
And that's your space to say just what it was to you. That's your place to be validated. That's your place to process your feelings. But when you leave therapy and you want to talk about that to someone else, I think it's very important not to exaggerate. That is a big communication tip that I have. Now, abuse.
Yes.
I think one thing that is very interesting about abuse is that my definition of abuse personally is anytime you use something in a way that it wasn't meant to be used, you're abusing it.
Oh, I like that definition.
That's my definition for it. So sometimes we think of abuse as a violence, and a lot of times I think that most of us abuse each other unintentionally, just because we do not understand each other's purpose.
Right.
And when you don't, and I think that's our Western world. I think our Western culture has always and is progressively abusive, and it's bad for the human spirit. Like, for example, let's just talk about the way we abuse ourselves. We abuse ourselves by eating bad. We eat processed foods. Our body was not made for processed foods.
Yes,
right?
stationary lives as well.
Exactly.
Yes.
You abuse yourself all the time when you don't exercise. Your body is made for movement. It needs to move.
Correct.
It has to, right? You abuse yourself when you don't go outside. Like, we need vitamin D, we need the sun. So I think that sometimes when someone hears that word abuse, they're like, you abuse me, they take it to mean something rather than saying, you don't understand who I am, and you're not treating me in the way that I need to be treated according to my purpose and my design. And that's, I believe, how we should hear it. So that way we can get on track with saying, okay, I'm sorry I did that. That was not my intention. It was not to hurt you. Tell me what is a better way to work with you or connect with you or move forward with you. I think those are important conversations you need to have after therapy, but instead people stay stuck on being offended by the word abuse. They're triggered when they hear that word because they think it must mean that they were sexually abused, and sometimes some people have been sexually abused, and it doesn't necessarily mean that, they were raped or molested or improperly touched by someone in their family, but sometimes they were exposed to things before they should have been, because someone was irresponsible. Things like that happen all the time right within your home. So it happens. But I just think that people need to not be so triggered when someone leaves therapy and they need to talk to their loved one about the things they're working through. It's very important to know how to have that dialogue. And that's why I like having a therapist to work out those exercises with and talk to them about it with. So that way when you go and you talk afterward, you can have it in a successful way that doesn't rip your wounds open.
Yeah.
Ooh, this was good.
It was.
Thank you. Oh, listen, somebody left a comment. She said, should you stay in an environment where you're constantly triggered if it is affecting your mental health? What do you say?
Ooh.
That's a great question.
This is hard. Even I do kind of hate to say this. I don't believe all feelings are valid. I think sometimes it's okay to ask yourself, am I being crazy right now? When it comes to something that you may be acting too sensitive about something, not all the time.
But let's back up.
But,
let's just stick with the actual question.
Yeah.
And I'm saying this communication tip is very important that we start with the actual question when someone asks something. They said, if your mental health is being affected, should you stay in that environment? We don't need to judge yet whether or not their feelings are valid, but do you think that it is good for them to stay in an environment like that?
Does depend on the person, but sometimes it depends on what they mean by affected. Because do you mean challenged, or is it like you're in a bad state all the time?
Well, they're saying you're constantly triggered, and that could mean a lot of things. Like I do think, in my opinion, and I always say, if when you're talking about communication tips and strategies, it's important to speak subjectively instead of objectively. Okay. In my opinion, there is nothing wrong with separating yourself if you're constantly triggered. That doesn't have to be permanent. I don't know. Sometimes that can mean that you take a weekend away. Sometimes you need a week away. And to me, if you're saying I'm triggered, that means you have a pain, right? Let's take it like if you have a splinter under your skin, right? You're not going to heal until you take the splinter out. Right? Anytime someone touches that splinter, it's sore. It hurts because it's infected. So if someone is triggered, they have an infection. So do you need to remove yourself so that you can heal the infection? I think if you can, then you should consider doing that for a period of time. If you can do that. It doesn't mean you have to permanently cut people off. And I think that that's the part where therapy helps, because I used to be the queen of the cutoff. Like, I used to cut people off until I hit a point in my life where I couldn't cut people off. And then I had to learn, like, you need to learn conflict resolution. You know what I mean?
But that's the thing. It's like, what if you need to be exposed to that trigger to where it's something that you should get over?
But it depends. It depends on whether or not the people in your environment, understand how to help you out. Because you first, like I said, if you want to heal, you don't need someone constantly poking in your sores. And it depends on whether or not these people are intending to be malicious. And I think the intent is very important. Like, sometimes people are not intending to hurt you. If you had a splinter, if you had a wound and I kept bumping into you, but I didn't know that you were wounded in that way and I didn't understand that, then I'm not trying to hurt you. It's just that people should be able to bump into you without, it hurting you, right? But if you're hurt, you can't take being bumped into, so you have to separate yourself. Take the splinter out and go. Now, this is why I say important. Therapy is so important, because once you start that process, it may not take you years. Like I said, it might take you a few weeks. You might be able to get through this in a weekend. It may be a conversation. It may be some conflict resolution. Just a nice exercise, something quick. It could be an afternoon. But I think it is very important, in my opinion, to identify when you need space.
But don't you have to identify if it's valid first to know whether you should be triggered or not?
You don't know.
What do you mean
You
don't
just
know?
know you're triggered.
But
You don't
shouldn't
know
you
if it's
evaluate
valid
that?
or not. I mean, you should, but that's why you have to separate yourself to do it.
I don't know.
Really? Okay, let me hear it. Let me
No.
hear it. I want to hear your perspective.
Because I feel like, I know it's not realistic, but it would be helpful to be like, okay, I feel this type of way about something,
Mm-hmm.
but should I? Because sometimes I think that does save you a lot of energy to where, what's the point of even feeling like this? You actually think about what you're feeling. So
Yeah.
that leads to the point of where not all feelings are valid. So then you have to validate it or not first in order to decide that?
Well, I think that's the beauty of therapy. Therapy is not, they're not telling you whether or not you should feel the way you feel. Their job is to help you process those feelings because they're there
All the time?
all the time. They're going to help you process those feelings. The goal should be that you're not triggered anymore.
Are we talking like normal person or someone with a disorder as well? So that's all the time?
I think that everybody has a disorder. That's my opinion.
Really?
I
Oh,
do. I
okay.
think everybody's got something. ADHD, ADD, anxiety, PTSD. Like, I think that everyone has some level at periods of time of their life where they're dealing with some form of mental illness. I'm personally more afraid of people who don't identify that they have an issue. Versus the people who just think, oh, I'm normal, I've got nothing wrong with me. I think everybody's got something.
But isn't there kind of a compass you have to decide whether or not, like, that feeling is important? Like, for example, if you're identifying someone with avoidant personality disorder, you'd have to know the moral compass to be like, okay, this is not the norm because of how our society is at that time. So wouldn't you have to say that this feeling could possibly be right or wrong?
You could, but it doesn't mean you're not triggered, though. That doesn't deal with the trigger. That's what I'm saying. That doesn't deal with the trigger. So if you take a look because I want to make sure that, thank you so much, Brittany. When you're talking about triggers, you're triggered whether it is valid or logical or emotional or not. The point is you're triggered. So, and their question is, if you're constantly being triggered, should you leave? And I'm saying if you are constantly triggered, then even maybe you are the problem. But maybe you do need to separate yourself so you can figure out what your problem is so that you're not triggered anymore. But you can't see that. At the beginning, you can't see that. Only thing you know is how this word or this action or this behavior made you feel. And all you know is this is bad. So by yourself, you're not thinking, maybe I'm the problem. Or even if you are, how do you deal with it? And that's the part where therapy comes in. And that's why it's good to take a minute, back up. Even some people go on a drive. That's what I say. It doesn't have to be permanent. You don't have to cut people off. But if someone does not know how to support you with your mental health journey, and they're not supportive of it at all, then I think that you're going to have a really hard time healing. And the goal should be healing. That should be the goal. It shouldn't be that, okay, I'm triggered in this way and you need to accommodate it. It should be, this is something I'm dealing with. I have a goal to get better. I want to get better. I don't want this to trigger me anymore. I don't want this to have power over me anymore. I need some space and some room and some time to heal over this so that way I can come back, perhaps, and function in peace and harmony.
Okay.
At least that's my thought. Someone said, what do you do if you never found a good therapist?
Oh, that's hard.
I
feel for you if that's the case.
I do think that it is, I think it's good to never give up on yourself and maintain as much hope as possible, in my opinion, that there are solutions and answers out there for you. And there are different therapists that have different specialties and expertise, right? And just like, we put therapy under one big blanket, but we fully recognize in other aspects of medicine that doctors have areas of expertise. If my foot was hurt, I'm not going to go to an ophthalmologist. You know what I mean? I go to a podiatrist. So I think it's very important to make sure that we do good research and to make sure that we go to a therapist that has experience with the issues that we have. When I went to therapy, I went to someone who specialized in trauma-informed care.
Right.
That's what I was dealing with at the time, and that was life changer for me. And I was very blessed to be able to be led to that. And I'm a person of faith. I am unapologetic about that in this discussion. I'm a great woman of faith. Okay, so I put that out there, and a lot of my perspective comes from my inspiration in that space. So I'll just be open about it. But I've prayed about that, of where to go and to be led to the right person, and that worked out very well for me. So and I still, that's a practice for me. Sometimes I'll end up, maybe I'll go to therapy once I'm feeling better, maybe just once a month as a check-in. And when I'm going through a hard time, I might be there once a week. But I think it's important to have a place where you can fall apart and not have to burden other people's feelings while you're dealing with your own.
So how do you know if it's working? Because, like, let's say you start off going once a week, but
Yeah.
then you don't get to the point where you go in once a month or maybe once every 3 months. How do you know if it's actually working?
I think that's when you don't have a good therapist.
Okay. Yeah, that makes sense. Or try different forms of therapy, because not all therapy is talk therapy. Because some people are frustrated with the fact that talk therapy isn't working. You might have to try something new, and that's the case.
Yeah, I mean, you got to do your own research.
Yeah.
There's so many different types of treatment out there, and holistic care, and opportunities for people to find out what are other practices. And sometimes you need to bring some of those new methods to a therapist. Maybe I'm not saying they're a bad therapist, but if I put it like this, when you're an adult, you stop having milestones for your growth, right?
Really?
I think that that's part of our problem. I think that's a big issue. Like, when you're a kid, you knew, okay, by the age of 3, I should be doing this. By the age of 5, I should be doing that. By the age of 10, our milestones once we become adults, become so superficial. I want to buy a car. I want to buy a house. Not like, when it comes to their growth and development as a person, it becomes really superficial and really materialistic. And I think that that's caused a lot of people a lot of mental health issues, because we don't have goals to say, you know what, by the time I reach this age, I don't want to be dealing with this issue anymore. Like, I want to be totally healed past my childhood wounds and trauma. Or by this age, I would love to be able to talk about this particular topic and it doesn't make me cry. You know what I mean? Like, we don't have real milestones for how we want to develop. And so I think that we have to really get a vision of ourselves as, what does the healed version of me look like? And once you know that, just like if you wanted to go to a plastic surgeon, you have an idea of what you want your body to look like, and you would find the plastic surgeon who is good at doing those things. And I think you need to do that with a therapist. You need to have a perspective of, what does the healed version of me look like? If I was on the other side of this mountaintop, if I was past this issue, what do I look like? And then you can work backwards and find a therapist that can help you get there based on their expertise.
So why don't you think we do that? Why is a lot of our stuff turned into materialistic things?
Man, that's such a good question. I think that we get so materialistic because most people are disconnected from who they really are. We start to define who we are by what we can obtain versus defining who we are by who we can become.
I think I could see that, because a lot of time, like in older times or whatever, you were kind of defined by how your kids saw you. And now it's not really like that, because of course your kid would see you as like whatever you raised them as, whatever sort of thing. So now that you don't have that anymore, it kind of did turn into your car defines you, your bank account, your house does, all that sort of thing.
Absolutely. And it's just not healthy, because you find, once you define yourself on superficial things, then your conversations become superficial. Like, for example, if I go to a meeting, right, and I'm going to meet someone for the first time, maybe say I'm at a networking event, or maybe you bring your boyfriend home one day and we're going to meet him. And the first thing you're going to ask him, what do you do for a living?
Oh, yeah.
And if he's not proud of that, and, then he's going to try to avoid having any real honest dialogue. And we don't ask people like the real questions, like, what are your values? What do you believe in? What motivates you? And people bring that to their dating too.
Yep.
What's your favorite color? What's your favorite movie?
What do you bring to the table in terms of all the sort of materialistic things?
Exactly. Like, we don't ask real questions. And so we wonder why we have these lives that are adjacent to what is real and what is healthy for the human spirit, because we're disconnected from it. We get really superficial. And I think that, honestly, this is why I think therapy is important for that reason. Because we do not have a language for truth. And I've been saying that for a long time. I talk about it in my book. We stay on the surface all the time, and if you become disconnected from what's happening underneath the surface in your dialogue and your relationships, and you disconnect from that even within yourself, there's all these things that are happening, and it makes you sick.
Yeah, you sort of feel inadequate if you are not pulling up to that level that society has set, and then that brings all the insecurities. And a lot of people are talking from insecure places and languages nowadays. I hear a lot of fear or disappointments or whatever it is. It's not really from a positive place majority of the time.
Yeah. I mean, insecurity is just kind of accepted. Like, we expect people to bend to our insecurities rather than saying, let me go to therapy to work out my insecurities so that I can go into a relationship without being insecure. And most of us end up married to our insecurities. We're not even married to the actual person that we're with. We're married to our fears of what we think they may do to us.
How do you know something is an insecurity?
Ooh-wee. You might take us into a whole other discussion.
Yeah. That's hard.
Man, okay, remember I said your relationship with time.
Right.
Relationship with nature.
Yep.
Relationship with math. Like your relationship with reality. If you cannot deal with reality, you're insecure.
What does that mean? Can't deal with reality?
Like, you cannot face reality. If for example, let's say I'm dating someone, right? Okay. And if I can't face the reality, if I ask them a question, guy, you have a girlfriend? And he's like, no, I don't have a girlfriend. I'm like, yeah, but I've been through it before, and men always tell me they don't have a girlfriend, they're having a girlfriend. And I keep that in my head constantly, all the time. Like, I'm not dealing with the present reality. I'm stuck. My relationship with time is fractured. I'm stuck in the past, so I cannot move forward with a new person.
So is an insecurity and a trigger the same thing, sort of?
Well, I think the triggers are great indicators of insecurity. Like, if you are triggered, if something triggers you, that's a sign that an insecurity is there.
I see.
That needs to be healed and dealt with. I just think that people want to identify the trigger, but they don't want to heal it. And if you can't feel it, you can't heal it. It's okay to feel it, but get the healing that you need. That should be the goal.
Okay.
Yeah. I mean, that's... So do you guys in your peers, and this will be my last question before we wrap up, and thank you so much everyone for joining us. Yes. Throw in your final questions if you have any, and we can put them up on the screen. Do you guys actually talk about healing? Like, what does the healing side of that look like? I always hear, like, I'm a professor. I teach at a couple different colleges, and my students are always giving me their notes for, what kind of mental illness they're dealing with, or they pull me aside to talk to me about their pressures and everything. But I never hear them talk to me about, like, I'm healing. This is something I've healed from. So is that a conversation? What is healing?
I can tell you like what it looks like, I guess, for a lot of people.
Okay.
It's usually pretty abrupt, kind of extreme. So a healing could be, for example, cutting off your family. Or it could be, well, I look the way I want to now because I've changed my style in this way, or body modification, whatever it is. That's another abrupt thing.
Okay.
It could be hastily saying things and like running over. Well, that's just me speaking my truth once again, something very abrupt. So usually it's what it looks like is an extreme to combat the extreme devastation you were going through prior.
Well, that doesn't sound like there's any room for healing.
Yeah, exactly.
Here's the thing that bothers me, and I'm concerned, and this is why I'm concerned about our younger people. I can't believe I'm old enough to say our younger people. That bothers me too sometimes.
Yeah.
But my concern is that they're always basing their healing based on what they think other people should be doing for them, and I think that's dangerous.
Oh, I didn't think about it like that, but you make sense.
Yeah, I mean, it just seems like it's always connected to relationships all the time. Like if my mom will do this, I can heal. If my dad will do this, if my husband, if my wife, if they can do these things, then I can heal. But I just don't think you can make people responsible for your healing journey. Brittany says, my healing is starting now and it feels like being more secure and not being a victim to my emotions anymore.
That
is beautiful.
Yes.
I love that. And it's empowering. It's empowering. And I don't know if people feel more powerful when they feel like, that they are this hostage of victimization. And I think that that's a triggering word when you say victim, because people think that you're not compassionate. And that's not what it is. It's just that, you want to move into a powerful place. And you're more empowered if, one, you don't need anyone to help you heal. That's why forgiveness is powerful. Like if you can let something go, and you don't need anybody to validate that process, you're unstoppable.
The thing is, how that doesn't translate well over here is that let's say the initial insecurity trigger, whatever you went to therapy for, you get the confirmation that you have it. Now that confirmation is the power. They don't see that emotions or being a slave, well, quote unquote slave to it, is a lack of power. We don't see it that way.
Yeah, I mean,
it's fuel for us.
I agree with that. I think it's so important. And like I said, getting a therapist is very, very important. And, thank you, Andrew Tate, for whatever that commentary was that triggered this conversation. Mm-hmm. But I think it's so important that people understand that therapy is about healing. It's not about making everyone validate your emotions. It is about you being able to be empowered to get past those feelings so that you can function and live a healthy, balanced life, and to my point, my opinion, have a very healthy relationship with the reality of the life that you're dealing with. And it's okay to be in pain sometimes. Pain is an indicator that something in your life needs to change. And there's nothing wrong with change. The problem is we won't change fast enough. We like to wait and dig in and sit and be complacent. And we like to, we want everyone else to change around us, but we won't make the change and lead it and be our own hero and lead that necessary change. And I think that therapy is a great first step so that you can identify how you can save yourself from whatever it is that's causing you that kind of harm.
That makes sense. A lot of us numb the pain. Like if you go to a doctor for, I don't know, joint pain, nerve pain, whatever, they'll just tell you how to get, they'll give you some medication for it, but not what the cause of the pain was. So you're just sitting there numb to it all the time instead of dealing with it actually came from.
I'm glad that you know that at your age. I mean, that's one of the issues that I have with substance use. And I say that we have a culture that is geared for substance use disorder syndrome. I think that's what they call it now, right?
I think so.
Where people are addicted. We're always trying to numb. We try to numb it in any way, from, whether it's alcoholism, whether it is, through legal drugs, illegal drugs, whether it is sex and relationships. We're always trying to numb things, but we don't actually want to heal it. And that's a big problem, because if you are a person who cannot feel pain, you will die.
Oh, yeah.
Like there is a reason why God gave us pain. If my body hit the stove, I need to know that this is hot so I don't burn my skin off. Like that's the whole point of pain, is so that you can make a move. You need to make the move you need to make to get yourself to safety, which is back to Brittany's point in her question, is saying that is it okay to remove yourself if you're being constantly triggered for the sake of your mental health? Some kind of move needs to be made. Something.
It does.
Some kind of move needs to be made. If you are being constantly triggered and you're constantly in pain, there's something that needs to change. Something. And sometimes what we do is we think we have to cut everyone off, when really it's just time to do a deeper dive, find out what is causing that pain, what is that infection, so that we know if anything needs to be cut off and how to cut it off in a way that is healthy.
I could see that.
Perhaps.
Yeah.
What do you think?
It's still a little fuzzy on that part, to where it's like, I don't know. I feel like, for me at least, I would evaluate, should I even feel like that in the first place? To where a lot of times for me, that would help the pain in that situation go away. To be like, well, are they even trying to hurt me? I would try to rationalize it first and then evaluate from there. But I do understand what you're saying.
That's really personal for me. I think part of the issue for me is that I've always been a very rational person.
Mhm.
And if you go through therapy, or there's an exercise, I hope you look it up, it's called DBT.
Mhm.
And there, if you develop DBT skills, they have this thing where you have your emotional mind and then you have a logic mind. And your logic mind means you're extremely rational. And your emotion, so sometimes people are on one extreme or the next. They're either really emotional or they're really rational. And I was really rational. And my rationale, my logic really got in the way of my healing journey.
Oh.
So my therapist had to help me bring those two worlds together into what she called a place of a wise mind, and being able to, because I completely ignored my emotions. I was that person. I could just cut things off. It didn't matter how I felt. That was my logic. That's how I thought. I didn't really process feelings. I just kept going to, why he said that therapy is a waste of time. He says it because you need to take action and keep going. I used to live like that, and it was actually a distraction to my healing journey. So I had to learn how to bring that side of it in, and I had to learn how to process my feelings and validate my feelings, even the feelings that were not necessarily logical. I had to walk through it.
But how did you know you were being too rational?
That is the reason why it's good to talk to a therapist, because she identified that I was too rational. I didn't think that way. I thought that, like, there's nothing wrong with the way I think. You know how he was joking in the beginning and says his logic is infallible? Like, that's how you think when you're a logical person. You think that your logic is infallible.
Oh, okay. I can get behind that. I understand a bit more now.
Yeah, Brittany says diving deep is hard because you may have to change your entire lifestyle, and that is scary to take time to go get help. It's so true.
Agreed.
And most of the time, I think that a lot of us go to therapy thinking about everyone else we want to change around us. We don't think that, like, no, you actually need to change. Right. And that was difficult for me. Like I said, I was like, man, I'm around a bunch of crazy people. I feel like I was surrounded by idiots.
I understand that feeling. Everybody's stupid to you, and it's like a constant. You can't connect with people. You can't do what you have to because you're just like too busy in your own ego, where everybody is stupid but me.
That's your ego and your logic can be really big blockers from healing. And regardless of how logical you are, I think where anxiety happens, and I'll speak for myself. I'll speak subjectively. Anxiety happens when your logic doesn't align with your emotions, and you're out of alignment, and you're trying to find harmony, but you can't. And that's why therapy is great, because it can help you to deal with one side or the other and bring those two worlds together. Because oftentimes your feelings can be in great conflict with your consciousness. It can, and thinkers understand that. We're usually people who are thinkers, deep thinkers, they're always conflicted.
Yes.
Always.
They're usually pretty indecisive, something like that.
And it's tough.
Yeah.
It's tough. I mean, some people don't even take the time to consider what is logical. I think that's unhealthy too. But, if you're always this person, like, I get this, I get that, I understand both sides. Like, now how do I bring it in? That's rough.
Oh, yeah.
Man, this was an awesome conversation.
It was.
I hope we get to do more of these.
Yeah, I do too. This was fun. I didn't expect it to turn out like this, but I liked it. It wasn't what I expected.
Yeah, well, thank you so much for coming on my YouTube channel and my Facebook and talking to my guests and helping me have this dialogue about why therapy is important, and allowing me to bring communication tips and strategies into it. My name again is Tia Ramey, if you got a chance to tune into this late. And a lot of some of the principles I've talked about came from my book. It's called Cancel: Mastering Difficult Conversations in a Modern World. You can visit my website, tiaramey.com, if you would like to get a copy of it. It's also available on Amazon. And if you love audiobooks, you can purchase it on Audible as well, and come and talk to us again about this dialogue. But I really appreciate you joining us. Hopefully, you'll be more than willing to join in on another live broadcast like this, where we get a chance to bridge the generational gap and discuss these things. But anyhow, thank you again, and I will chat with you soon.